in conditions. Then, and very low image in the society. So if you go back to, around 20, 25 years back, or even more than that, almost 30, 40 years back, and there were nursing schools and colleges, but still people were not coming forward for nursing. You know why? Because of the social stigma. But now things have been changed. Things changed a lot. Okay, so this was also one of the important factor. When we go back to the previous history of nursing, we need to know and no cadre differences. So everybody, those who are working in the hospital, were considered as a nurse. Whether you complete your PhD in nursing or MSc in nursing or BSc in nursing or diploma in nursing or A&M in nursing, but no matter, or even you trained. So there were no cadre differences. Now, we can just compare the past to the present. So, what's the current scenario in our profession? So, especially the healthcare setups are very much equipped and they have high quality in care, right? So, especially the field of diagnostics as well as the treatment modality. So, we have a lot of advancements. So, the advantage of having more facilities, the advantage of having more facility, that nurses are able to practice what they exactly learn. Okay, so what they exactly learn. Okay, so this is an advantage. And increased number of nurses. So anywhere you go nowadays, I don't know whether it's a fortunate thing or unfortunate thing. Everywhere you can find the board what nursing college, so and so nursing college, so and so nursing college. Okay, so I'm also expecting some nursing college should come in my name, but so far I have not seen. you know, anyway, everywhere you go, you can find like the boards. Especially, when I was there in South, then I was thinking, okay, so this is a scenario of South. But when I came to the North, my outlook was completely changed. Here, more every single almost 5 years, I mean 5 kilometers or 10 kilometers, once you can find a nursing college or a school. So ultimately, nurses are produced more in number. So this is also the current scenario, the considerable current scenario we can include here, and the cadre differences. So any corporate level of hospitals or any big hospitals, if you go, the cadre differences are more. Like people, the nurses are not only identified as nurses, right? Especially in the government sector now. What is our role? What is our identification? If you get into a government sector, then you will not be identified as a nurse, but nursing officer. Correct? No, nursing officer. Okay, so you'll be getting the officer cadre. And in the other hospitals also, if you go, then you can find infection control nurse, then mental health nurse, or a pediatric nurse, so theater nurse. The cadre differences are there. Then got more standardization. This has got more standardization. That means you need to be well enough to compete with others. If you are not competent enough, then ultimately you cannot deliver a healthy nursing care. Then more opportunities, right? More opportunities. Nowadays, all these health institutions, especially even these colleges also, we are facing this issue. What is that issue? Major threat, turnover, staff turnover. It is very unavoidable because opportunities. You are working in one hospital and that area, if you are not comfortable, then ultimately you can go and find a job in another hospital. Okay, so these are the current trends which are going on in our profession. Now, we can move on to this components of the nursing services. So here, you know, four pillars or four major components you can consider. One is patients, nurses, then hospital or healthcare units, and available facilities. First of all, the patients. Okay, so without patients, you cannot run the show, right? So here we are organizing this conference. Suppose imagine you people are not there, then I should take my session only for the table and the chair, right? So you people are the center point here. It's likewise in a hospital. If you go, patients should be there. Everything is patient centered. So the basic factor, the basic necessity of a hospital should have the patients first of all. So always our nursing services also mainly focused on or based on or with the circle of the patients only. The nurses, obviously. So nurses are playing an active role here, right? So nurses, when we talk about this nurses or nursing care, we know specifically certain things are there with us, right? Even the third person also they can give the care. But when we nurses, when we give the care, then ultimately we know, how much we can differ from others, how qualitatively we are different from the third person. Then the hospital and healthcare units. Okay, so hospital and healthcare units, of course, every hospital have their own policies, right? Every hospital they have their own policies. Suppose 100-bedded hospital, how many nurses they need? How many nurses they are in need in area? If you want to function a 100-bedded hospital, you can have 150 nurses also. You can have 75 nurses also, or even below than that. But we should know the quality matters, right? The fact is, the adequate number of nurses should be there. That should be the policy of the hospital. Then available facilities, other available facilities like the equipments and this availability of number of nurses and this nurses accommodation and this nurses this other beneficial stuff. All these things will be included here. Okay, so these are the components of nursing services, we can say. Then patients in nursing care services. Now we directly will move on to the patients. Okay, so what exactly the patients are meant in this nursing service? One is the center of nursing care. As I told earlier, without students, teacher cannot take the classes. Without a patient, the nurse cannot give the care. Or without patients, the hospital cannot run their show. Okay, so the center of nursing care are the patients, we can say, because everything should be planned according to the patient's need as well as their, because these needs, when we talk about the needs, it is vary from one person to another. Then having physical and emotional needs. For any patients you go, their major issue is what? What is their major issue? Because their problem is already they got some health issue, physical issue. Ultimately, whenever your physical condition is not good, that will be reflected in psychological aspect, right? So we can consider altogether, we can consider physical and emotional needs. Then from different background and they have different expectations also. They come from a very different background, like socially, economically, then their previous experiences and their relatives. They must have undergone the hospitalization, similar conditions, or their friends or somebody, or they must be the caretaker before for their relatives in the hospital. So all these things are matters when we analyze their background as well as their different expectations also. Some people, for a minor pain or something, they feel like they just express so much. But some people, some patients, even though they are paining so much, but they will not express it much. So different kind of expectation. So what we need to do, in which way we need to be careful, though you have handled the different kind of cases and different kind of scenarios, you should not generalize. For example, one fever patient is coming and pyrexia, you are treating that, you are dealing with that patient, and next time when you are going to the next case like this, and there you should not say or you should not expect the same thing from the previous one, because the previous patient was another individual and this patient is another individual. Though the problems are same, but the expectations are not the same. Okay, right. Then needs attention at any time. And some cases, always they need the attention. And some people they are okay. So if you explain them, then they will be in a position to understand. But some cases, even we nurses sometimes we feel like, oh, they are torturing us, right? So nowadays, there is one system come in our what is that in our NABH accreditation process. That means this nurses calling system. Every patient will be given one, alarm, one switch. And if you just switch this thing, then it will be directly it will go to the nurse's station and nurses has to run. So after getting this one, I know very funny way. Some hospitals what they are doing, they switched off this. Because every time it's like a calling bell. It's like a calling bell. They are getting this one and they have to run to the patients. Anyhow, okay. So needs attention at any time. The major determinant for of nursing services, quality of nursing service. So here, quality overall we can say it is a part of the quality of care. So how the hospital gains a reputation, how one hospital gains a reputation, or how one health center gains a reputation, the nursing aspect playing an important role. Okay, so how professionally the nurses are performing their duties. Okay, so your duties and responsibilities already studied a lot, and you know better than me. So I'm not going to that area into detail. Right. Then expectation of a patient from nurses. Right. So what the patient expects from the nurse normally. When you go to the patient side, how you will go? Will go like this, like this. How you will go? Actually, uh, most of our nursing colleges, we are performing very good, and I also, performed from the low level to the higher level in this nursing profession. Just now, I'm a little bit, I just withdrawn from our profession, but I have seen this. We are very much teaching this and that, and training and sending them to the clinical postings, and but certain basics we forget. The personality, what, of course we have different kind of personality, but our approach is, here our aim is to treat the patient. So when you are treating a human being, when you are treating a patient, you, patient is not a machine. Of course they come for repair in their body, but we should not consider them as a machine or a car or whatever. So they are the human beings and they are the emotional beings. So always we need to make our attitude pleasant when we are approaching the patients. Okay, so we need to have the kind attitude, or not even kind, we can say what, a pleasant attitude. How pleasant? When you make your face cheerful, right? When you are making your face cheerful and charming, then ultimately the patient will approach you. Or when you are keeping your big face, ultimately nobody will come to you. Okay, right. And then clear cut communication. So communication, what you are trying to communicate, that should be very much reachable to the patient. So most of the occasions, even the teachers or the students or whoever it may be, we are failing in our duties and responsibilities because of this communication. There may be a communication gap, or there may be an issue of your, of presenting a matter. Sometimes even we teachers, even I personally, I feel like I want to explain certain things, but my words and my expressions are not adequate to reach out the level what I want. So that's why, always whenever I personally go for my lectures or anything, my body language will be, more than my language sometimes, because then only I can make the person to understand what I am trying to say. So here we need to be very careful, because already we are playing with the life of the patient. So this communication should be very much clear and pinpointed. Then availability towards a need. Okay, so some patients, especially when they are in a in pain, or after the surgery, or after this accidental episode and all, their expectation is somebody should be there at their site. So either their relatives or the nurses or the doctors, the patient's expectation is that, because some patients, they are anxious and they have fear. Okay, so every nursing student's favorite nursing diagnosis, what is that? Fear and anxiety. Now you people are more lucky. Now we need to write it separately. Right. So you have two major nursing diagnoses over there. Right. So obviously, because this is a new environment, new scenario, new people, and moreover the pain, right? So I don't know whether we are able to understand or not. Whenever we are going into the depth of pain or the physical challenge, ultimately, completely we will be out of our track. Okay, that means we will be almost our needs, especially the emotional needs, are focused. Then care and concern. Okay, so these are the basic things. Okay, care and concern. Care and concern means because he is an emotional being or he is a human being, so he needs some care. So we should not stop our efforts till the level of care, but we need to go beyond that. That is concern. It's like duties and responsibilities, right? Suppose you are not coming to the college today. So your thing is what? You are calling the principal and you are telling the principal what? So, ma'am, I'm not coming today. Okay, you are taking chutti. Bus, you are going. So this is your duty. But responsibility, it's different. You are calling to your principal and you are saying, ma'am, I'm not coming today. So I have arranged or I have exchanged my duties to somebody and she or he will take care of. Likewise, students also. Okay, so you are saying to your colleague, yesterday I have taken search me. So you just tell the patient, so don't worry, I am here. If you need anything, I will come and help you. So likewise, so that is a concern. You understand? So you should not just stop. You go beyond that, then you will enter into the stage of concern. Then creating a warm IPR, interpersonal relationship. Right. So how many of you have the belief in this IPR? I I appreciate you, but at the same time, this is a major area of our weakness also, right? So I don't have to go into depth because there are a lot of things associated with this IPR. Sometimes the patients also, what will happen when you are maintaining a very good IPR, they will be entering in the stage of more dependency on you. You're getting my point? Suppose the patient is there for a long time. Okay, so 1 month or 2 months, the patient is there, and you are there for a week. Okay, and you are giving very good care with the IPR, and everything is fine from your side. And you are also getting a very good satisfaction, and the patient is saying that, they say that what the transference feelings and all. Oh man, you are just like my granddaughter. Even she don't do these kind of things, but you are doing that. You are the best, right? All these things. Very next week, you are just out of that area now. You are shifted to, you are transferred to, you are posted in some other area. Another person is going. Do you think this patient will be satisfied? No. Okay, so these are the challenges we face in this IPR. Then competency. Okay, so competency. You need to be competent enough because nursing is not just what? Nursing is not just with the level of knowledge what you have as a theoretical. So you need to be skillful. So the patient expects from you to be more competent. How you can be competent enough? So patient easily they can understand the way how you give the injection. Right. So sometimes what will happen whenever the patients are getting the injections, the patient may have already the fear, and when normally what we used to do, we will divert the patient, right? We will ask them, so what you had in the morning, or your son came and visited today. So simultaneously we talk and we do the work and we will get the things done. So sometimes even the patient may say that, sister, how about the injection? Then it's it's over. Right. So that much you need to be competent enough. So these all the things are expected from the patient, from the nurse. Now, challenges in nursing service. Some of the very practical challenges I have mentioned here. One is patient's perception, the level of patient's perception. Perception means we know, right? Though it's a psychological or psychiatric term, but in general terms, what is perception? How we analyze and how we consider the normal happens. Okay, so the level of patient's perception. So some people, their perception will be in a very positive sense, and some people, their perception will be in a very negative sense. I know, in the hospitals, when the patients are taking the treatment, sometimes they say, Yeah, now surgery is over. Definitely, they will make me to stay for another 1 or 2 more weeks. So their perception is what? Negative perception. The hospital or the doctors, they are asked the patient to stay to what? Collect more money. This is their perception. And some people, no, they are asking me to stay 1 more week. So this 1 more week again, they will observe me and they will make me to get complete cure and they will send me back. Okay, so the perception. This one. Then the workload of nurses. So how long you can work continuously? It depends. Right? It depends upon the workload. Matlab, 40 patients are there in a ward and only two nurses are there. How that scenario would be? You'll be on your wheels. Right? You will always run here and there. But at the same time, if you have adequate nursing personnel in that unit, ultimately, the workload will be shared and this very positively and enthusiastically you can deliver the work. So workload of the nurses, if the nursing workload is more, ultimately it will be reflecting into our quality. Then limited resources. Okay, limited resources, obviously. We are also the human beings, right? How long you can work without the food or the water. So sometimes it happens when we are involving with the, with our work, so ultimately we'll forget everything. We will not drink water, we will not have food, and everything goes on just like that. Okay, so these are all the things are respected, and this is also one among the challenges you can see. Then, degree of illness. Okay, so degree of illness. Suppose, you imagine the patient is in a very critical condition. So, critical condition. So, how that scenario would be? Have you ever got exposed to the palliative care? Have you ever got exposure to the palliative care? Palliative care. Yeah, I think some of you have got the exposure. I'll give you just an example. Okay, so it is not just for this content, but my own personal experience, I'll tell you. So we were posted in Trivandrum. There is the Trivandrum, the Pallium India. This is the number one institution for palliative care in our India. Okay, so now they have established all their branches, this Pallium India. You can check in this website. And it was started around, I think, around 20, 25 years back. So that time and all, palliative care means nobody was having that concept in our India. In Western setup, it has come. Palliative means, the ultimate aim of the palliative care is what? To reduce the suffering and pain of a patient who is expecting that death. Okay, so we are promoting a comfortable, you know, process of this death for a end stage of the person who is in the end stage of life. Okay, so palliative care. So I was posted there, and in that palliative care, almost 70 cases are there. 70 patients always you can expect that that bed occupancy is almost 70, and always you can find this 90% of the beds are being filled. So one day, what happened? One patient was there, and he was almost, last in stall. I mean, he was at the terminal phase of his cancer. This thing. Everyone we knows that at any time he may collapse. You imagine, we are in the last unit, we are in a palliative unit, and there, patients in their last stage. And one patient, he was asking that sister, I need to smoke. I want to have a puff. Then you imagine, suppose if you have been there as a nurse, then what would have been your decision in that case? Because everybody we know, maybe today or tomorrow, this person may go heaven or okay, so he is in that stage. Okay, so just imagine, or you tell me, so what would be your this what you will go for a cigarette or you will not? Huh? You will go. The sister got very much confused. So what to do? Because the patient is saying, it's a very, I think, I hope, I mean, everyone, you got the exact scenario, right? Because at any time the patient may die. But his last wish is what? To have a puff. Okay, so immediately she was thinking what to do, and he's asking this, and she was telling that to the patient, you just wait. Okay, so you just wait. Normally we do that. She waited for the doctor to come. Okay, so she waited for the doctor to come. Doctor's very famous doctor. You can check in this internet. His name is Rajagopal. Okay, so he's the father of this palliative care in our country. Okay, so he came. He's a very big personality. Then the sister went and, as soon as he entered there, she immediately ran to the doctor and asked, sir, this patient is asking for a puff. Shall I give or what you are saying? According to your this thing, I will follow. And this doctor looked at this nurse just like that, and he said, sister, you decide. You decide. Sensitive moment for us on that particular day. Okay, so I'm not here to say whether you take you or not, but decision is yours. So doctor also said it is yes. So likewise, you know, the patients are like that. And some patients, especially this palliative unit at all, they fight like they because of the intensity of the illness. I have seen some cases and all. Like the maggots used to come from their cancer wound. Okay, so it is very pitiable condition. So in that condition and all, the handling of the patients are really challenging for us. Okay, right. And also the prognosis. Okay, so some people they show very good prognosis, and some people, whatever you do, you cannot get a very good prognosis. So that also we can consider here as a challenge for our nursing service. Now we move on to this life values. Values. What do you mean by values, basically? What do you mean by value? Am I boring you all? Okay, no? Right. So values. In general words, tell me. Ah, somebody is saying value is the value. Yeah, that value only. What is the value? Actually, I tell you, you know, in general words of understanding, value is an essence. Okay, so whatever you do, and if you add up little bit value with that, and the result will be very much enormous. For example, I tell you, maybe so many of you, your favorite dish may be Rajma Chawal. Right? If you ask me, then I have a list. Okay. Right. So when you are taking that Rajma Chawal, and there, somebody has served you without salt, how do you feel? How do you feel? Will you be comfortable? You will curse the person who served you. Right? So, but without salt also you can take. Without salt also, you can take the food. Nothing will happen. It's good. In fact, it's good for your health. Right? But when you add up little salt and when you take, then how about the results? This is value. You understand? Okay, so in our life, there are a lot of sequences and lot of incidents and lot of experiences and exposure and so many things are there. But wherever the values are there, then our efforts will be turning into more efforts. Okay, so this is a thing. I'm not going to the definition into detail. The core values of nursing care includes, I have listed 5 core values here. One is integrity, respect, responsibility, sportsmanship, servant leadership. Okay, so we'll discuss one by one. First one is integrity. Okay, integrity. So integrity means knowing and doing what is right. Okay, knowing and doing what is right. Of course, if I ask you, then you will say, if I ask you, okay, so something I'm asking you to do, then you know whether it is right or wrong. Correct? No, right or wrong. But the success depends upon not just analyzing or coming to a conclusion whether it is right or wrong, but how far it is right, how far it is. You understand? So we should not just make a judgment, no, yes or no. But if you are making it right, then you should know how many percentage is right, how many percentage is wrong. Okay, so you need to keep this thing in your mind. being a nurse, you should not stop with certain level. You should go one step ahead of always your decisions. Okay, right. Then, in this, four more this aspects are included here. One is commitment. Okay, commitment. So, how far we are committed towards our work. Right. So, some people I know in a ward, especially in the clinical area, uh, though when all these things are over, when all their responsibilities are over, even then they will not stop. Because I had a senior in our UG. I know, sir must be knowing Suresh, our senior Suresh, sir. One person we had, and he has completed his some BSc, some other this one, and then he came for our nursing. And when he was working in the hospital, like he was doing the third year, and we were in the first year. Okay, so one day what happened? Uh, he was there in the clinical area, and whenever he goes to the clinic, he'll forget about his breakfast, he'll forget about his lunch and everything, and he will just run behind the patients only. So that particular day also he was working there, and one patient was about to vomit. Okay, so in our condition, in our setup, we know emergency conditions may occur at any time. So suppose patient is nauseated and about to vomit, then what we may do normally? Immediately we'll shout for, hey, bucket, or some kidney tray or this thing. And this person also he was shouting, and we were all running here and there. But nothing was there. You know what happened finally? He did like this. He just wanted this thing in his hand. You will not, it's very, and when we were looking at him, like, what? What's happening? So this was the commitment he has towards his patients. Okay, so I'm not asking you to go to this extent, but little bit you need to think about yourself. Then courageousness. Be courageous. What is courageous? What is courageous? If I ask a question, okay, so far, I have presented this much. Okay, so almost half or more than the half thing is over. So I ask somebody to narrate. Then how many of you are willing to do that? How many of you? I hope at least 10% or 15% you will come forward. That means you are courageous. Okay, so it is courageous means it is nothing but the readiness of you to accept the responsibilities. Okay, so courageousness. Then honesty. So obviously, when we talk about the honesty, you may be thinking like, we may be ultra truthful and this and that and all. But I am telling you one thing, this is not only for as a nurse you should have, but in general also, being a normal human being, you should have this principle in your life. That is, there should not be any hide and hide in our life. If you maintain this principle, your life will be so beautiful. Many occasions, what is happening, you will hide. And the people, the others, they will find the different kind of thing in us. So they'll be attracted and they'll be approaching us. And finally, what will happen? Major part of our thing we are hiding, but at any one point of time, it may be reflected. Okay, so we should not go into that kind of situations, and these kind of situations make your life more miserable. Okay, so honesty, this is a very good principle. Then discipline. Okay, so discipline. Maybe the college may impose some disciplines or disciplinary steps or whatever, but these are all the things are there. But otherwise, also, you should know one thing: every one of us, we need to have our personal discipline. Okay, so our personal discipline. So, if this is for me. Okay, so though your friend or somebody may ask you to do certain things, but you need to maintain your personal discipline and the purity, we can say. So, these are the things are there in this part of integrity. Then respect. Okay, respect. Normally we used to say what? Especially the student and teachers always we used to clash. The teacher will say the student is not at all respecting me or not at all minding me. Right. And the students used to say what? What? Give respect and take respect. Correct now? So these are all the things are a part of our game. Okay. So treat others the way you wish to be treated. So if you want to be respected, then you need to pay respect. Okay, so nowadays, I am not going into the moral values of these things, because moral values and all, even we are unable to differentiate. Okay, so we are confused which one is falling in the category of moral values and other categories, because it differs from individual to individual. Being a, I am more into this psychology and the psychological aspects and this counseling and all right now. And whenever I am involving with these kind of activities, I feel is every individual needs to be approached with a different packages. Okay, so that we will come to the later part. Now we continue with this. Okay, so treat others the way you wish to be treated. Accept. Okay, so accept. What is acceptance? First of all, you should accept the patient as he is a patient. Patient is a patient. Means whatever you do, how much ever you take effort, something we cannot satisfy them at all. But some people, even a minor steps what you initiate, will be highly satisfied. It's like a difference between what? A buffalo skin and we can compare it with anything. Okay, so just like that. Accept, then considerate. So you need to consider. Suppose even their claim is very vague, or their claim is very irrational or something, but you need to be able to give the correct definition or correct explanation for them. Okay, so you should neglect their claims. Okay, so always we used to say what? You can neglect the symptoms, but you should not neglect the patient. Okay, right. Then attentive. So whenever they are in need, we need to be readily available to attend. Then encourage. Okay, so encouragement. This is very, very necessary, especially every one of us, we need this. Imagine every day, 24 into 7, you are working and doing here and this and that, you are doing and everything, but you are not getting adequate encouragement. At one stage, you will be losing the interest. Similarly, when the patients are taking some efforts and they are participating in their, recovery process or in their prognosis, and they are showing some kind of positive symptoms, then you need to encourage them and appreciate. Okay, so don't be a miser in this aspect. Okay, appreciate. A word of appreciation. Never it's gonna make you to lose it. Okay, so you need to appreciate. Next thing is responsibility. Okay, responsibility. So this thing, we can classify the individuals into two categories. One is optimist and pessimist. Okay, optimists always come forward to take up the responsibilities. Pessimists always they will sit at the back. Okay, so this one, embrace the opportunities to contribute. Okay, so whenever there is an opportunity, jump into it. Okay, so for example, when you are walking on a street or walking on a road, you are finding some person is in need, then you need to show the readiness to act. Okay, so helpful. So helpful. Normally in general life also, normal life also, we need to help each other. Okay, so always you should learn the technique. You should learn the technique of enjoying or gaining the pleasure on giving, not receiving. Okay, so this is a little bit more than our level, but if you make your mind in such a way, your life will be more beautiful. Right, right. Then conscience. So what is that conscience? So every one of us, we have our conscience, right? So conscience. So immediately, whenever you do something, your conscience will say whether it is right or wrong. That is a personal judgment. Your conscience is giving the, helping you to find the, judge the solution. But normally what will happen, we will suppress our conscience and we will do the things. Okay, so that should not. Then accountability. Okay, I told you, it is accountability is even more than the responsibility. Okay, so accountability means though you are not physically present in that scenario, but we will make sure whatever you want that is happening in that area. Accountability. Then preserving. Okay, so preserving means Okay, so you are taking some efforts and you are making sure that these things are continuously, it is happening. Your efforts are not being wasted. Then reliability. Reliability means, normally we are very much lacking this one. Monday we will tell something, then Tuesday we will say some other thing, and the Saturday entire scenario will change. Again Monday we will go and say something. No, it should not be reliable. Because your policies should be strong enough. If you have a strong policy within you, that policy will be so strong and you will be reliable. Okay, right. Then sportsmanship. What is that sportsmanship? Normally, when we are involving with the sports or games or whatever, what will happen? If you have the real sportsmanship, what we do? What we do? We will encourage others. We will encourage the right, especially in the matches and other areas. You may find that if somebody gets injured, then another person, the opponent team member immediately will go and kind of thing. So cooperation. Everybody, wherever we are working or wherever we are expected to be there we need to cooperate and we need to contribute. Then fair treatment. So fair treatment, ultimately we know, like we need to do whatever is expected or more than expected. Okay, fair treatment. Then gracious. What is graciousness? It is a kind of a good sense. Okay, so your approach by seeing your look or by seeing your talk, by seeing your body language, the person who is in need should come and approach you. That means your hands are always like this. It should not be like this. Because that means you are ready to attend them. You are ready to accept them, like that. Then honorable. Honorable means some kind of gentleness. Okay, so some kind of gentleness. You should not have the craze of jumping into the unnecessary things. Okay, so you should not be attracted by certain, stimulus. Okay, so you should show the readiness. You should show the gentleness in you. So I know if I want to be gentle, then my behavior should be okay. So simply I'm cracking some non-standardized jokes or some kind of these things. Then ultimately I cannot maintain my gentleness. So this is honorable, humble. So though you have achieved so much, though you are a big or what is it? Very famous or very eminent personality in your own field or something, but you should not know you are a human being and there are so many expecting you for them. Okay, so this simplicity and this humble attitude should be there. And the final one is servant leadership. Okay, servant leadership. So here, this is a classical responsibility of a leader. If you want to take up a leadership, then you need to play the role of what? Servant. You need to serve, basically. You are ready to serve. You need to. If somebody wants to know or you are teaching something, then you need to come to that level and you need to teach. Okay, so that is more important. Here we are serving for the common goal.